My name is Norm Volsky, your host, and this is the Digital Health Heavyweights podcast.
Thanks, Norm. It's an honor to be here, and it's been fun to work with you over the years.
Hello, and welcome to the Digital Health Heavyweights podcast with your host, Norm Volsky. And today we are really excited to be joined by co-founder and CEO of Hint Health, Zak Holdsworth. Zak,
thanks for having me. Appreciate it. Thanks for having me.
Absolutely. So Zak, would love to be able to, walk in to this podcast with just explaining a little bit about your background for folks that are viewing and listening that aren't as familiar. Hint delivers powerful software automation that gives organizations the administrative power of a health plan, allowing them to rebuild the healthcare delivery system from the ground up. Hint has 3,000 clinics running on Hint, with Hint helping with tasks like member enrollment, billing, automating workflows, running a direct care network, keeping systems up to date, and even tracking reports. Prior to leading Hint, Zak was the VP of Business Development for WellnessFX and was an associate at Voyager Capital. And, really excited to join you on this podcast and talk a little bit about Hint and what you guys are doing in the market.
Sounds great. Yeah. I think just in terms of my background, I originally was an engineer, electrical engineer, and kind of minored in computer science, and started my career in an engineering capacity. Eventually kind of moved into consulting. While I was in engineering, actually, I did some pretty cool, I'd say a little bit of digital health and a little bit of hardware, software, med device type stuff as a consultant. But I eventually kind of moved into consulting. Ultimately, sort of fast forward, I ended up at Stanford, did my MBA, and kind of jumped into one of the startup. Basically, joined as a VC as a kind of an intern / analyst, I guess, and pretty quickly jumped into one of the startups that we funded called WellnessFX. And from there, that was my first really, I'd say, real true experience in healthcare, and got to know, can share more in a bit, but kind of got to see under the hood a little bit as to how fundamentally broken it seemed, while also learning sort of some of the ropes. And then ultimately ended up, jumping into a startup with my colleagues from WellnessFX, which called Hint Health. And I'd say, the primary focus there, getting into the why, but the primary focus there is really building the operating system and technology infrastructure to support the direct primary care movement. Yeah, and so yeah, we can talk more about that, but that's sort of where the very quick version, I guess.
Yeah, well, obviously, access to care is a hot button, and, direct primary care is a very exciting avenue, to allow for that at scale. So, really love to hear it. What inspired you to get into healthcare, from software consulting?
Yeah, I think to begin with, it was more through the lens of kind of human performance as opposed to sick care. I was doing some endurance sports stuff. I was pretty personally motivated by I was a little bit into the sort of quantified self movement. I was tracking everything. And this WellnessFX was really a couple of really interesting, inspirational founders, Brent Vaughan and Jim Keen, that, super inspirational guys, and had this great vision. And I just kind of got hooked on it. It was a combination of, it was basically the first direct-to-consumer clinical diagnostics company, and it combined my interest in tech and my interest in kind of personal health. I'd say from there, I think my interest in healthcare transitioned more to what are the fundamental issues that underlie the healthcare system, as opposed to the kind of human performance side of things. So that's where I gravitated more towards.
Okay. Very good. So as an angel investor, you've directly participated in approximately 100 startups. What do you look for in a founder when investing?
Yeah, I think it's about that number. It might be slightly less.
But we said approximately. We're not going to hold you to it.
I don't want to overestimate that one. But yeah, I think probably a couple of things. Probably the main thing is just perseverance. Is this person going to give up? And my experience as a founder is There's heaps of times I've thought maybe I'll just give up, and I kind of feel like you read in the news about the company that goes public in 4 years or whatever, billions of dollars valuation. You sort of see those stories. And you also see articles about companies that showed up out of the middle of nowhere with billion-dollar valuations. When you look under the hood, most of those companies stuck around. They're 10 years on, they're 10 plus years in. And so the founders that kind of got there, it was probably like 5 years of just feeling like failures at some point. And so I think perseverance is the primary one. I'd say
And how do you index for that? Like if you're only meeting a founder for a couple hours, maybe it's in person. Like how do you vet for, ability to be resilient and someone who's just not going to give up?
Yeah, I think honestly, it's I don't know, it's gut feeling. I think.
Okay.
Yeah, I don't have a magic wand for that one, but I think like sometimes people get into being a founder for the wrong reason, and that they're
Yeah.
sort of the allure of it. There's if someone's like ultra passionate about solving a problem. I'd say the second thing, these two things are like in combination. I'd say the second thing is, do they have some unique insight or some unique passion where there's almost like the only person in the world that should do this business, like
Yeah.
yeah, or something
I
like
think it
that.
has to be more than passion,
Yeah,
personally. I
yeah,
think it has to be
yeah,
passion coupled with like
some
an
insight.
obsession to
Yeah,
learn and be an expert in
right.
that specific niche.
That's
So like
right.
you can be passionate about something, but unless you're going to, read every book and every article and talk to every thought leader in the space,
Yeah,
like you can be passionate about something, but if you're not knowledgeable as well, you need to have both. And
yeah,
I
that's
think
right.
like that is a very, very powerful combination when it's the most knowledgeable person in the room. And oh, by the way, they happen to be the most passionate about it as well.
And I think like to your earlier question, like how do you identify perseverance? I think those two things are kind of coupled. It's like this person's
I agree.
ultra passionate about this. They're very knowledgeable. You kind of feel like maybe a little bit stupid talking to them because they just like so much about this topic and you just don't know anything, or like you felt like you knew and actually you really don't. Like you want someone to kind of make you feel almost like you know, like that, and then they're not going to not solve that problem, right? And now the other thing with perseverance, which is interesting, is a number of companies. There's one company I'm involved in right now that totally, completely, 1000% is not working on the same thing I invested in. And actually, I like the thing they're working on now more. It's actually
Hmm.
happened a couple of times. And again, it just comes down to the founder that's just like, I'm just not gonna give up, right? Like I've
Hmm.
taken money like that's from these people. I'm gonna do. Now, I will say there are occasions where I say, hey, I think you should give up and go do something else because this isn't working for whatever reason, or maybe you should pivot. I don't think you always want to hold the line forever, but you at least want someone that is both, like you say, passionate and knowledgeable, as well as like has grit, basically.
Yeah. Walk us through your experience as, VP of business development at WellnessFX and like how it made you more effective, as the founder of Hint.
Yeah, I mean, I was very lucky. I was a young, pretty young guy, and hadn't really had a business role before. My role had always been more of a technical or consulting, but never really like sales or business development. I'd always found myself kind of gravitating a little bit to those areas. But I was really lucky with both Jim Keen and Brent Vaughan, who are both like pretty inspirational guys. They kind of took me under their wing somewhat, and they're like, hey, what do you want to do? And I was like, I want to do BD and sales stuff, and they're like, yeah, cool, let's go. And so because they saw something in me. I'm not sure what it was, but they saw something in me, and so I think partly just learning the ropes from these guys that have been around the block and had deep experience. I think there's probably another thing is that they were both like they both had different types of experience, but they both, I'd say, were in some capacity an expert in healthcare or the healthcare system. And I was for sure not. So just learning from there, I remember I'd go into Brent's office and I'd say, hey, what's a TPA? And it would be like a 20-minute lecture. And I'd go, okay, that's great. And so there's just like a sharp learning curve. I think the other thing that I'd say I learned in that experience at WellnessFX that kind of followed us to our next company, because I met my co-founder there. He was running engineering, and I'd say we didn't have a growth problem at WellnessFX. There was ultimately the companies acquired. It wasn't like a meteoric exit, but it wasn't a, I'd say it was a success, but not like a, massive one, right?
Yep.
I'd say the thing that I'd say held us back wasn't lack of growth. It was lack of retention.
Mhm.
That really is brutal in a company. If you don't retain your customers, it doesn't matter how good you are, it just is brutal. And so
Well,
I
how
think,
could you be good if you're not retaining customers,
yeah,
right?
exactly. Yeah,
So I
yeah,
guess my
and
question
yeah,
would be,
exactly.
what would be a cause for a company with a great product to lose customers? And
Yeah, I
like,
mean,
how
I
do you
think
fight against that?
the issue with WellnessFX, and I think there's others that have come along. I think in many ways we were too early. We started like 4 companies, right? There's like 4 companies there's 4 independent companies that are now doing one part of what we were doing, and they're all like doing quite well, right? Now, I think part of it was it was easy to get a customer because it was basically we're doing a blood test, connect you to a consultation. It was like we'll visualize your data, we'll get you your basic order and
Mhm.
release labs outside the traditional like physician networks. And what we found was that people were really intrigued and interested in that first touch point. They wanted to have that first consultation, but getting people to come back repeatedly doing this thing. And at the time, it was like you needed to go get your arm stuck with a needle, right? But we'd come to
Yeah.
you, you go, but it was, pretty invasive. We found there was just a drop off from 1, 2, 3, 4, 5. Like there was just a really sharp drop off in
Mhm.
the order of something like 50, 60, 70%, which actually is actually not bad for a product like that. But when you compound that, it's brutal. Like you just can't build the engine. And we didn't have emotion around building a recurring relationship, and we never nailed that. And I think that was, probably one of the key learnings. It's like you need to have that. That's almost the first thing you need to get is high
Yeah.
retention of your customers before you scale.
You cannot scale without customers willing and regularly singing your praises. Like if you look at 2 of the
To
most
be fair,
successful.
I will say though that it was just to clarify though, it wasn't that the people weren't singing our praises. Like people loved the product. It was actually I'd say a subtly different problem, which
Mhm.
was it wasn't that people didn't love it. It was just that there was a behavior modification piece that we didn't nail. Anyway, I interrupted you. I think I agree with the comment you're making, but I just
Yeah.
wanted to be clear that
No, of
WellnessFX people
course.
loved that product.
Yeah, no, absolutely. But when we talk about like 2 of the most successful companies in the history of, capitalism, Apple and Amazon, like if you ask anyone like what is the ethos of those companies, and it's provided amazing customer experience.
Yep.
And if you do that, like it solves almost every other issue and
Yep.
just be obsessed with the customer.
Yep.
So, Steve Jobs was like, hey, if we create the best products that people love and want, we're going to be really successful. If that's our one sole focus, same thing with Amazon. It's like, if we're not providing an amazing customer experience where they couldn't even imagine life without us, like if we can solve that, everything else falls into place. So they both have that North Star of, tremendous customer experience. And if they don't think their product or service provides that, they don't bring it to market
Hmm. Yep.
and they keep iterating on it.
Yep. That's right.
I think, all of us can learn a lot from that. What were your greatest learnings at WellnessFX?
Yeah, I think probably the number one learning for me there was just there's a sort of rubric when I talk about why we started Hint Health, and I think the learning was just related to how fundamentally broken the system is. Like I came in thinking like, oh, it's can't be that bad, but then you
Yeah.
sort of like get in and you're like, oh my god, this is like really bad. And I think the rubric I kind of used when we were starting this company was like, in theory, if everyone in America had access to this thing, if we just said like in the case of WellnessFX, if everyone in America, 300 million people, became a $100 billion company, every person was a customer, there'd still be $1 trillion probably, or maybe it would wipe off 50 billion or something. It wouldn't be zero impact, but it wouldn't fundamentally transform the system. It would
Mhm.
still be basically broken, but maybe a little bit better. And I think like most of the innovation we're seeing, especially when we start to look at, okay, why don't we go do something to try to actually transform the system? Most of the innovation we're seeing, like everything pretty much, you can bucket into what I consider basically an incremental innovation.
Yeah.
Like if you just apply the rubric, any company in healthcare, if everyone had that thing, would it fundamentally transform the system? And if the answer is probably not, like maybe it would incrementally improve it. Well, I put that into like, oh, that's kind of an incremental innovation camp.
Mm-hmm.
Like I think for me that was just the learning. It's like, wow, pretty much nothing's going to fix this.
Mm-hmm.
There's unless something fundamentally different happens, which was I'd say a North Star for what we're trying to hint, but
That's fantastic. So talk to me a little bit more about what inspired you to found Hint specifically.
Yeah, so I mean, we wanted to go do something that, like I said, potentially has transformative impact on US healthcare. And our kind of vision basically was like redesign the healthcare system to enable easy access to high quality affordable care. But that's like kind of sounds like a boilerplate vision, but we're like literally trying to be like, what would do that? And I'd say there was a couple of, axiomatic thoughts we had. The first was, a big part of the reason the system is broken is because all the incentive misalignment, the overhead, and basically the lack of price transparency that's attributed to the insurance fee-for-service infrastructure. You could extend that to all of the innovation that's built on top of that infrastructure. Like I'd include like the value-based care movement. It's just like an abstraction layer on top of the insurance fee-for-service chassis. If you kind of like go into first principles. So the first thing was like most likely whatever the innovation is probably can't be found on a foundation of that broken chassis. It would need to be like almost like off that substrate. So that was the first axiom. The second axiom was like there's no, because of all of those things we just talked about, the back of basically the primary care system that had been broken. It was like, it turned this what should be the most important part of healthcare into a essentially like a glorified referral engine.
Yeah.
With incentives to drive referrals to the most expensive cost centers, right?
Yeah.
And to not catch things early because, in a backward sort of way,
refer to specialists, refer to inpatient,
yeah.
main clinic imaging, like all that kind of stuff.
Yeah, it's just a madness, right? And there's no kind of functioning healthcare system in the United States in the world that doesn't have a highly functioning primary care system. And so I'd say there was two axioms. The first, like whatever it is, it probably can't be sitting on top of the insurance fee-for-service infrastructure because you're just dead in the water. And then second, it probably needs to restore the integrity of primary care. So from those axioms, that's kind of what led us down the path to founding Hint Health.
I love it.
Yeah.
And I'll just mention this. I think it will be music to your ears. I'm a student of this like wellness longevity world, and I watched the documentary Living to 100 on Netflix. Dan Butner, is been a big advocate of blue zones and like been studying these communities for a couple decades now. And what I found very interesting is that the country of Costa Rica, who has like this much budget for healthcare compared to the US, every single citizen of Costa Rica has a primary care physician visit them and do an annual checkup on them every single year, sent to their house.
It's like not that expensive.
It's not that expensive, and their health outcomes are tremendous, even with spending a minute amount of money on it compared to the US system. So like there are countries that spend a fraction of what we spend who have tremendous outcomes because they do really focus on investing in preventative medicine as opposed to treating illness.
Yep, 100%. And in that instance, like those physicians most likely build a deep, enduring, long-term trusted relationship with that individual. They're probably part of the community. They're probably, essentially like part of the family. It'll be kind of like having a family member that's a doctor. So like all the things that we saw in basically direct primary care clinicians back in the early days, we're like, wow, like this is not this ivory tower concept that might in theory work. It's working now. Patients love it. Doctors love it. It's, it's actually, if you look at the data, it seems to, longitudinal data, it seems to actually save money, improve outcomes. It's kind of like hits all the buttons. The problem was when we started was there was like less than 100 DPC doctors. And so all my VC friends are like, "You're insane! Like, what the hell are you thinking?" And like, it was really hard to fundraise, and early days it was a little bit, took a while to build some momentum. But it was the only thing we could look at was like, okay, if we could help, basically our mission became to power and enable the direct primary care movement and make it the new standard. So that I actually hadn't heard that analogy of Costa Rica, but so that we could help move towards a world more like Costa Rica's primary care system, and that would, if you sort of apply that rubric, okay, if everyone in America had access to this type of care, would there be basically, somewhere in the order of magnitude of $500 billion or $1 trillion, or just like a very large, substantial portion of the problem, either directly or indirectly, would just evaporate, right? And our thesis, and I'd say I believe it more today than I did there, is this, that's true. So we decided to build a company to support that community.
When you're solving for foundational issues, they take time. Like, these are not things that just, appear overnight and immediately, gain steam. Remind us, when did Hint start operating, and just walk us through like what some of those early days were like when people thought you were crazy.
Yeah, it's about 11 years ago now. Late 2013, we stepped away from WellnessFX. I'd say we incorporated the business Q4 2013, so really got started early 2014. Yeah, I'd say we spent about a quarter or so, a couple of months, just looking at different ideas. We're just looking at everything. We'd go talk to VCs, we'd talk to founders, we'd talk to doctors, we're just sort of in an exploratory mode. And, one of the things that was really interesting is there was all these really interesting ideas which were like, seem really profitable, but wouldn't actually achieve anything. Like one of my favorite worst ones was, well, let's like build an AI that will automatically like upcode charts to, and make an emergency room like 30% more profitable. It's like, oh my God, that's a great business. And there's actually businesses doing that and just dominating, right? But you're like, that's really bad.
Yeah.
It's like, I would just like not be able to go to sleep at night, basically.
Well, yeah, like obviously, like what's in the news right now is, denial rates, by health
Right.
plans.
Yeah. Yep.
Like there were people that like created systems that denied claims at a rate that helped large health plans make an exorbitant amount of money.
Yep.
Again, good business if you're an investor, but how do you sleep at night?
Yeah, and it's just very subtle on the margin. Like it's probably not actually that drastic what they're doing. It's probably, like a 2% change or something, but 2% across the population, it's like billions of dollars of additional. So anyway, we just kept running into these kind of direct primary care doctors to begin with. We're like, those guys are a little bit sort of doing something a bit strange almost, but we just kept coming across them going, wow, actually, but it's pretty cool. And so eventually we started to basically say, hey, listen, like, what are your problems? And we started just interviewing these doctors. And one of the things that just kept coming up was they're like, we'd see them just operating their day-to-day business. And they were all doing membership-based care where they were charging a fixed monthly fee for essentially unlimited access to primary care, telemedicine, urgent care. And they were using spreadsheets to manage that process. And so we thought, well, we can do better than that. Like many great businesses have been started from replacing spreadsheets. And so we thought, why don't we do that? And so we basically built the membership management billing infrastructure, and I'd say like pretty quickly got our first customers. I mean, we sort of started really building the software, and 30 days later we had our first customer. It wasn't that complex to build the MVP. From there it evolved. We're now doing like basically something like $1 billion a year in payments through that. There's 1 million plus members across thousands of DPC clinics. So it's sort of scaled that part of our business. But we also, another pattern we saw was our customers started contracting with employers. The employers saying, hey, we'll fund that. And so the business relationship between an employer and a clinic is quite different between an individual consumer in a clinic. So there's different onboarding, enrollment, payment. It's just like different tools needed. So we built the infrastructure to support basically employer direct contracting. And now there's, probably something like half the members across those I think 1.5 million or so members on the platform. Approximately half of those are actually sponsored by an employer.
Yep.
And then we built out the infrastructure to support networks, which was another really interesting trend we were seeing, where networks were forming. And so we just gave them tools to allow them to connect with other clinicians in the ecosystem.
Yep.
And so now we have an EMR, and we also have a network. Hint Connect is basically us contracting with our customers saying, hey, join our network, and then an employer, or let's say an innovative health plan, can have a single contract and then get access to hundreds of independent local DPC clinics without needing to contract with each one directly.
Fantastic. I love that. What was it like getting your first few clients up and running versus today when bringing on a new client?
Yeah, I mean, the first few clients, it was just basic blocking and tackling. You'd get someone that they're, oh yeah, I'm interested in that, and then okay, great. Okay, well, here's the process for getting on board. Would make it up, and they're like, well, I'm not quite ready for that yet, and you'd go, well, why is that? And they say, well, I have to like figure out how to like get all my data and migrate it, get it, basically they're saying migrate my data to you, and so they were, oh, we'll do that. And so we took the data and we got their passwords and logged into their systems and did it for them. And so we were like, oh wow, that made that process easier. And then the next step was like, oh well, I don't really trust you guys. I hope, I'm willing to do a pilot, but it's my core business. And so I remember this story of one of our first customers, a guy called Dr. Rob. I tell this story probably too often, but he was like, hey, I really love what you guys are doing. The pilot's going really well. I love you guys, but I was like, why haven't you onboarded yet your entire panel? Why won't you let us like flip the switch? Basically, he says, well, and I said, hey, listen, you're not going to offend me. He said, well, I've spent like 8 years getting to like 500 patients, but I'm still paycheck to, or 300 patients, and I'm still paycheck to paycheck paying my staff. And I'm really worried if you guys make a mistake, I'll miss payroll and I'll bankrupt myself and I'm back on the streets basically. And I was like, oh my God, that's like a incredible reason. So I just said, hey, tell you what, Dr. Rob, I'll personally guarantee your payroll. That if we screw up, I'll personally guarantee it. And he went, oh, cool, let's get started. And so then I said, turned around to my co-founder, hey, don't screw it up, because I don't want to have to fork out my money to support this guy. And just building, once you've got a few customers, then that trust issue goes away because people talk, oh, it's really smooth. So I'd say it's just like blocking and tackling, solving one problem at a time, listening to your customers, making sure that no matter what, that they're happy, like we talked about earlier, ensuring that you're delivering a really excellent service well beyond the value that they're paying, and just stepping into it basically.
Yeah, it's fantastic. How does Hint power memberships, billing, and payments, and how does that help the doctor-patient relationship?
Yeah, I mean, I'd say what we've basically done is build a custom solution specifically designed around this specific business model. There's like DPC and kind of concierge, and so there's a bunch of, I'd say, off-the-shelf membership management stuff you could buy, but none of it really like interprets, or I'd say really has it doesn't really like know how to deal with like the specifics of a DPC model, like small things like, well, maybe maybe like Norm, you're paying, but actually you have your family, and so you've got some type of like pricing plan that is a discount because you're family, but each of you has a patient record because we're integrated with the EMR, so each of your family members needs a record, but actually you're paying, and there's like a rules engine that calculates your fee and do all of that in a way that's fully automated end to end. It's like, okay, well, there's quite a bit in there, right? And so if you do an off-the-shelf thing, you're probably going to end up basically doing it manually. And so I'd say our ability to just almost like set and forget your business. So as opposed to in the traditional model where billing and payments is like 30% of, 30 cents on the dollar or something. Well, in this thing, it's like basically fully automated end to end for a relatively inexpensive, for a fraction of the cost of an FTE. And so, yeah, it's just that sort of maniacal focus on that customer segment. Yeah, and then we've just built tools specifically designed for them.
Fantastic. What is your philosophy when it comes to, building teams? Because companies grown a ton in the last 10 years.
Yeah. Oh, actually, and you asked a two-part question before I only asked the first. The part was, how does it help with the doctor and the doctor-patient relationship? I think the answer to that is you just get out, you let the doctor focus on the care. So you just automate all the administrative stuff for them, and so their job is to like do the care part. And they spend half an hour, 45 minutes with these patients, so they're actually like delivering an incredibly high quality service in that time. And anyway, so back to your next question, which is just what's the philosophy around building teams? I think they might sound like I read this out of a book or something, which I probably did, but I think at the end of the day, you're trying to find people that have a strong sense of purpose around the mission that you're pursuing. And that you sort of filter for people that seem really excited about the mission. And then you ensure that they're, highly capable. You have to, you don't necessarily need someone that is a world expert in something, but you do need someone that's highly capable and like driven, that has a shared sense of vision and around why we're coming to work. And then you need to like make sure that there's a really clear North Star, right? Which for us is like kind of easy, like we've sort of done the hard work of like defining our North Star. And then it's just about, to a certain extent, kind of getting out of their way and making sure you unblock people and stuff. But I'm a big believer in sort of like autonomy, and you sort of delegate, heavily delegate beyond people's like level. And sort of make people feel uncomfortable and sort of push them. And so seems to have worked for us so far.
Yeah, your company has an incredible culture. Like, how did you go about building that, and any guiding principles that you follow to just build an excellent culture?
Yeah, I think to a certain extent, the culture building thing just starts with, what are the founders like?
Yeah.
I sort of feel like culture is built through action. It's like, what do you do? Or like, and like at a certain point in time, it's actually almost like not the founders, because there's more other people doing stuff. So that if anything, like the culture can have a life of its own.
Yeah, and as time goes on, some of the founders are more externally focused than internally focused.
Right.
Talking to investors, talking to, influencers in the market, that are, talking at the highest levels. A lot of times as a company scales, the CEO and some of the other co-founders are less and less involved in the day-to-day operations of the business, and, communicating with internal employees versus external, that skews over time more external.
Right. Yeah, that's right. I think the sort of big, back, if you sort of look at the actions you're taking. So like, for example, me and my co-founder, we thought, why don't we build a culture of transparency? And we'll start to, like, it actually didn't start explicitly like that. We're like, hey, why don't we just share everything? Seems like too complicated to have information that only you and I have. And I mean, there's like kind of some exceptions, like we didn't share people's price salary and stuff, but even like we debated, like, should we even open that up? It's like, people can just know everything, know what we know. I'd say that we just, as we added people, and that was like really, with me and him, we had these like feedback sessions. We're like, oh man, thought that sucked the way you did that, or we're really transparent with each other, and with what we're thinking, and with employees and stuff. And I remember we'd hired a couple of people. We were really struggling to fundraise, and we had a dashboard of like days till running out of money on the dashboard. So we were telling the whole team, like, hey, we're out of money in 14 days, and they're like, well, what's the plan? It's like, well, I think we're going to get the money. I'm feeling pretty good about it, but I'm not 100% sure. And they're like, well, how,
What happens if we don't?
well, actually, like, what was interesting is they were like, man, no, you've got this, man. You've got this. And I was like, oh,
Yeah.
okay, cool. That was, and when the what happens if we don't question came up, and actually this is like a side topic, but this is a pro tip, I think, for startups. What I said is, listen, if we miss payroll, what we're going to do is we're going to give you double or nothing, right? So what that means is, let's say we miss a month of payroll and then we close a round. I'm going to back pay you, and I'm going to give you that amount of equity in the round we just did on top of your current equity. And so if it's like, the longer you go, the more back pay and the more equity you're getting. And we were, at the time, as like a lot of young people, they're like, oh yeah, they were almost like hoping I didn't get the round done. Because they're like, that's such a good deal for us. And it wasn't like people had, at the time, it was like lots of family stuff and like mortgages. They were like, yeah, let's go all in. They're sort of gambling a little bit. It's like cultural transparency, bring people along with you. And I think just sort of, there's some other values we sort of formalize, but I think it just comes down to reinforcing the behaviors you want in culture at the top. You need to show people, like, you need to live them and like make an example of them, right? You sort of have to do things that you almost like go over the top on it sometimes, so people can see, oh wow, like that's the value. This is, maybe it's okay if I do that action as well, and you sort of try to shape culture that way. But at the end of the day, the culture, in my mind, it sort of takes a life of its own, and you only have partial control of it at some point. So you want to make sure that early days you do a good job, because that's when because if you screw it up in the early days, it's it's going to just
Not
go
going to get
off,
better.
it's going to go off the rails at some point.
Yeah. Walk us through the automated member enrollment and billing solutions that you offer to your clients.
Yeah, I mean, it basically falls into 3 buckets. The first is, there's probably a few more than that, but the first is just the retail membership management stuff. And, that's a pretty hardened system, as I mentioned. It's, you can enroll members, and we've got, $1 billion+ going through that infrastructure. Then you can work with them, then you can handle eligibility and enrollment from an employer. So, a significant portion of the business these groups work with at scale, typically larger groups as employer. I'd say the third piece, which is really interesting, is in the early days, we started to see some really interesting patterns in our software where people would export data from one Hint account. They would email it to another provider where they basically said, hey, can you look after, basically subcap deal, a subcapitation type arrangement, where I've got 1,000 members that I'm looking after from an employer, but I only have clinics where I can look after 800 because the 200 are in Florida and LA, and I'm based in Colorado. So that what they'd do is they'd go find another direct primary care clinic, say, hey, can you look after 100 members? Can you look after 100 members? And then they would sign a contract, and then they would send those members in a spreadsheet, who would then upload them to their Hint account, and then use their Hint account to bill that group over there that sent them their membership through our employer infrastructure. And there's just like a lot of data duplication and manual workflow stuff. So what we did is we built like this networking infrastructure we call affiliates infrastructure, where you can go into Hint and assign, hey, these guys are an affiliate, this is my relationship. It actually hooks their accounts together. So now all I need to do is just assign that patient to the affiliated clinic, and we handle the enrollment, the payment, tracking, like the whole thing end to end. So as an employee enrolls, then they choose that downstream doctor, and it flows all the way downstream, syncs up with the EMR in that downstream system, and the payment automatically gets swept. So that's like quite cool, actually. You see lots of connections for me, thousands now of connections across our customers. Then what started to happen is we then started actually working with a small number of like innovative health plans that are actually working with Hint Connect as well as our customers, and they're actually using our APIs to manage their own network, because they want to have a DPC network and they want to contract with many clinics, either through Hint Connect or directly. And so there's sort of a an automated sort of like almost like DPC, like you could almost think of it as like an API for working with DPCs, which is, sort of market it that way, because I don't think, our customers aren't necessarily like devs, so they don't probably resonate with that message. But it's sort of like one way to think about it.
Okay, fantastic. What does automating workflows do to support complex employer contracts? And can you just tell us an employer story and how Hint helped them? Because a lot of our listener base, comes from that market.
Yeah, I mean, I'd say if you sort of think of the legacy service chassis, right, it's all about the claim, right? And so all of the technology is built around processing claims. In a DPC model, well, they're not really processing claims, or they're not doing that at all, right? And so the infrastructure to support an employer doesn't exist, right? You can't just back into the TPA and you're good to go. The providers, when we talk about sort of giving these providers the administrative horsepower of a plan, because they can kind of like automate a lot of the process that a plan would probably do. But it's a subtly different approach where the contract's different, the payment model's different. It's a recurring thing versus a transactional thing. There's no prior auth. There's just like a lot of different stuff.
Mm-hmm.
And so small things like you can set up an eligibility feed, which gets batched nightly and synced into our system. You can automate, okay, this is the rate, this employer, multiple states, they've got a different rate depending on which state they're in. We have a rules engine that allows you to kind of like adjudicate. Think of it as almost like kind of like adjudicating a claim, but the provider's not really doing it. The adjudication, this is our contract. Primary care visits are included. The following like medications are included. The following, let's say labs are included for the patient, but the employer is paying a pass-through cost, and so on and so forth. And the ability on our system, the admins will either automatically added through API pushes or through EMR pushes or typed in, hey, these labs happened, this is the office visit, these labs, these vaxes, these what they're basically build the bill, and then our system goes through and automates, okay, cool, they're with this employer, this stuff's free, we're going to add it to the invoice, but so the employee can see utilization. These past, we're not billing this payment to the employee, but we are billing it to the employer. And so essentially, managing the coverage rules in a way that's scalable and automatic. And so we kind of do that work for the provider. So they just need to deliver care once the contract's been signed. Now, the other thing is like every employer is a special snowflake. So often there's like quite a lot of complexity across many different employers. And so our system gives them the ability to kind of manage many different complex relationships all under one umbrella.
Gotcha. Very, very helpful. Hint has evolved a ton over the last decade. What have been some of the major milestones that you and your team are most proud of in the last decade?
Yeah, I mean, I think it's like pretty cool getting to 1 million members. It's
Yeah.
like pretty cool. And $1
That's
billion.
rarefied air.
It's a bit, $1 billion in payments is pretty cool. Those are sort of, I think those are more like performative metrics, right? They don't actually mean that much. I'd say the thing that I'm kind of most proud of, I think probably, and this is maybe not a single point in time milestone, but is something that I think we've achieved slowly over time, is building like deep trust within our community and being seen as I remember there was a customer I was talking with and they said, hey, we really appreciate your work you guys do. We actually don't see you as a vendor. We see you as a partner. And it was sort of quite touching to be seen in that light. And so I think that's like it takes a long time to build trust. And I don't know when the point in time was that happened, but I do feel like we're trusted by the community and seen part of the community. And it's things like, our Hint Summit is an annual conference we host, around kind of innovation and healthcare and direct primary care is kind of a focus of that. We're sort of giving back, to the community, and that's something we sort of support and fund, right? It's the community work we're doing, like trying to bring our community together. It's the continual investment we were making in our support so that it's just like really, really responsive support. The technology investment, everything we're doing is pushing towards supporting the success of this movement that these people are really passionate about. And I think they see it, and proud of that.
And what is it that makes Hint special and differentiates Hint from other direct primary care plays?
I think probably the main one is, it's a interesting and somewhat unique combination of, on the one hand, there's a number of vendors that have tons of funding and everything, but they have a DPC offering, but it's, let's say, not their primary offering. They will also, they'll serve the insurance fee service providers as well as DPC. So and they have a good product, but they're, one foot in two camps. So there's groups on that side. And then there's groups on the other side of the spectrum, which are, sort of like kind of almost like mum and pop shop type operations where they are kind of focused on DPC, but they're maybe a little bit amateur or whatever. And so, I think sometimes makes some decisions which I don't quite understand. We're sort of this combination of, we've raised like tons of money, we've got a lot of firepower behind us, and as well as like being dedicated to the movement. And so we're just able to do more. We're able to do more for the community. Like we're able to sponsor community stuff. We're able to do things like Hint Summit. We're able to stand up. Like we do a ton of like industry research where we like publish reports on like state of the state in DPC and like DPC trends and an employer and all this other stuff. Whereas like requires investment to do that, but it helps move the movement forward. Plus we also have the ability to invest heavily in like, our technology and services and new products like Hint Connect. So I think we're in this, I'd say, somewhat unique place of being capitalized, but able still to maintain focus on our mission, which is fairly unique because DPC still, it's still a fraction of the healthcare system.
Yep.
And so there's not really it's kind of hard to, to raise money from VCs basically. And that's actually one of the reasons we transitioned to more of a private equity type partner, because they're a little bit more aligned with the growth our growth profile.
Yeah. Great. What do we have to look forward to from Hint in the next decade?
Yeah,
What's the future look like?
Yeah, the way I tend to think about, I'd say, our strategic vision is basically 3 phases, and it's basically 3 phases over 2 decades. And we're kind of like 11 years in, and we're kind of 1.5, we're in sort of 1.5 into, almost at phase 2, but not quite there. Phase 1 is really just like build the foundational technology and ecosystem needed for the DPC movement to thrive. And so it's our billing system, it's our EMR, it's the the education stuff we've talked about. It's like we're actually working right now on a boot camp program which allows like folks to kind of get stood up. They've launched the DPC. So that's like phase 1. It's like store the foundation of primary care. And the second phase is like, what can we do to help unlock demand? And that's where really our network kind of infrastructure comes in. We saw that as a way to help essentially unlock liquidity on the supply side, as well as Hint Connect, where we're going out and actually contracting with employer groups saying, hey, you should buy this for your employees, and it helps grow the movement, right? So there's a little bit of a sort of a success cycle there, a virtuous loop. The third phase is what can we do either through building or partnering or buying, but how do we integrate downstream care? So if you think about the primary care system, it sort of represents, in worst case scenario, 5% of healthcare spend. Best case scenario, let's say 10 to 12%. Like Costa Rica, like your example, it's probably more like, I don't know, 12 or 15% of their budget is spent on primary care. So that's sort of the window, right, of like roughly how much you can spend on primary care within the context of a healthcare system. But the indirect spend that comes from the referrals and the recommendations from the primary care system is like, I don't know, 60, 70% or something like that. Or it should be, right? Like that should be a control point. And so the way I tend to think about how can we integrate downstream care into this ecosystem, but in a way that's authentic to this mission of doing so in a price transparent, incentive aligned way with little to no unnecessary administrative overhead, and not on the insurance fee for service chassis. And you're able to use those referral pathways coming from that primary care network to drive adoption downstream. And the adoption of that downstream amplifies the impact of those providers, which drives more demand for this type of offering. And you have all of these sort of independent, interconnected feedback loops that at scale, the way I tend to think about it is the way to take on the status quo is to build a sort of interconnected ecosystem. Think of almost like decentralized Kaiser, right? That is like when you factor in all of the different variables, it's an order of magnitude better. It's like a next improvement. If you can do that, then that system will grow to become the predominant system. And I kind of feel like, I don't think we will have got to 50+% of healthcare spend in a decade, but I don't know, you can maybe get to like 20% or something of all of healthcare spend is going through these types of new models that make sense. In doing so, you'd be transforming that part of the system, right?
That would be a very, very bright future. I think everyone would sign up for that if we could. You're in, a very stressful job. You're running a company, you've got investors to please, you got to, be able to attract and retain top talent. You got so many things on your plate. How do you stay level-headed? How do you, reduce stress and use exercise as a way to, be your best self day in and day out?
Yeah, I mean, I wish I did more exercise. Actually, a lot of the exercise I've been getting recently has been like handyman projects on the weekend or after work or whatever. I've recently put in like a 55-foot slide in the backyard, but I built like 30 steps up to it. I've been doing a bunch of gardening stuff. So like that's sort of like a recreational exercise, I guess.
Yeah.
I used to do tons of kite surfing and just have like, for one or another reason, I'm not doing as much of that anymore. I do like doing, CrossFit. I've got a rowing club I belong to, which I should probably go more. But it's a little bit of a patchwork of different random stuff. My New Year's resolution is to get into like a little bit more of a routine, I think.
And I think another thing that is vital to health is what you're putting into your body and what you're eating.
Mm-hmm.
So are there any healthy recipes you or your family make that keeps you, running at full efficiency that we might be able to, use as inspiration for our Healthy Headhunters video series, where we're making recipes and sharing some tips and tricks on how to eat healthy and make it taste good?
Yeah, I mean, I love ice cream, like more than I probably should, and I'm somewhat addicted to it. So I've been on this mission to try to figure out how do I and I just love vanilla, just like straight vanilla bean.
Yeah.
So I've been on this mission. I've got a couple of different ice cream makers to
I
try
have the
to create.
creamy, and I've made some like protein powder, like ice creams that, taste pretty good, and, the macros and the calories and, how much fat, how much sugar, how much protein, all that kind of stuff, carbs, and breaking it down. And it's definitely a much healthier alternative, and it still tastes great.
Right, yeah. I mean, what I've found is creating like a really fat and creamy ice cream, but with low sugar. What I find is there's a break point where if you take the sugar down to I now know why they don't have low sugar ice cream, because it just doesn't work. It freezes hard as rock.
Mm-hmm.
And so there's sort of a break point where if you get to that break point, it's basically really hard to create really ultra low sugar ice cream that doesn't just freeze rock solid. But what I have found is if you
and fat, like it has to have fat also.
Highest fat you can get, milk, so all like organic, super high fat milk and everything.
Yeah, or coconut milk or yogurt, whether it's plant-based or dairy-based. Like those are the things, some like nut butters, those can like get it, to a point where it doesn't become a brick of ice and it has some creaminess to it.
But what the hack though, I think is that I want to get to is if you are willing to eat it straight away, you churn it and mix it and eat it straight away, you can reduce the sugar content significantly, but you have to finish it like that day. So that's the trade-off, because it will still be just basically like super creamy and yummy, but you eat it straight away because if you freeze it, it's going to be like a ice block. That's basically the hack.
Or
if you put it in the freezer, it's done. The only way to eat it is to let it thaw, and then you're just.
I've actually rechurned it. Like, I bake a big one and I only eat half, and then I rechurn the extra, and then it turns out the same.
Okay, then maybe I have to try that. I found when I try to do that, it just like doesn't work that well, and so I've just resigned myself to just eat it on the spot, have really low sugar, eat it on the spot.
We'll have to do a Healthy Headhunters episode of some of my healthy, nice creams, as they say. Made with a creamy device. So, really appreciate the time and the health tips. So, thank you, Zak. Really, appreciate you joining us on the Digital Health Heavyweights podcast. And we're excited to see, Hint's continued growth and to see more employers offering DPC in a very convenient and accessible way. So thank you so much for what you do. And we'll be excited to watch your progress.
Thanks, Norm. Great to.
Thank you for joining. Please like, comment, and subscribe below if you enjoyed it.